Welcome to Pharmacology Insights, where we break down complex pharmacology into simple, easy-to-understand concepts. Urticaria, or hives, is characterized by the sudden appearance of raised, itchy welts, often surrounded by redness. When these symptoms persist or recur for more than 6 weeks without an obvious trigger, it is called chronic spontaneous urticaria. The underlying biology is complex, but one central feature is the activation of mast cells and basophils. When these cells are triggered, they release histamine and other inflammatory mediators that drive redness, swelling, itch, and inflammation. There are 2 main ways this activation can happen in chronic spontaneous urticaria. IgE-driven activation, also called autoallergic CSU, happens when IgE antibodies bind to their high-affinity receptor on mast cells, known as Fc-epsilon-1. Basically, it is the IgE docking station that keeps mast cells armed and ready to fire. When these receptors are cross-linked by allergens, they switch on early signaling enzymes like LYN and SYK. Think of these as relay switches, passing the signal down the line until Bruton's tyrosine kinase, or BTK, is activated. In non-IgE-driven activation, also called type 2B autoimmune CSU, mast cells are triggered differently. Instead of allergens cross-linking IgE, the culprits are autoantibodies, usually IgG, that target either IgE itself or its receptor, Fc-epsilon-1. By binding and cross-linking these receptors directly, they can switch on the same signaling cascade. In some cases, complement proteins like C5a also join in, further activating mast cells. Once BTK is turned on, it drives mast cell degranulation and the release of histamine and other mediators. But no matter how the signal starts, it still funnels through Bruton's tyrosine kinase, or BTK, before leading to degranulation and mediator release. Think of it this way. 2 different buttons can set off the same alarm. One button is IgE, the other is autoantibodies. But whether you press button A or button B, the alarm still runs through the same main switch, BTK, before the mast cell releases its mediators. Now, here's the problem. Many patients don't respond to antihistamines. That's because antihistamines only block downstream histamine action on tissues. They don't stop mast cells activation. That's where Remibrutinib comes in. In September 2025, the U.S. Food and Drug Administration approved Remibrutinib for chronic spontaneous urticaria. Let's look at how it works and the clinical evidence behind it. Remibrutinib is a highly selective BTK inhibitor. It binds irreversibly to BTK's active site, blocking the signaling cascade inside mast cells and basophils. Consequently, these cells are far less likely to release histamine or other mediators. The result? Less vascular leakage, less swelling, less itch, and calmer skin. Here's a simple analogy. Antihistamines are like mopping up a water leak, while Remibrutinib is like turning off the tap at its source. And because it works at the signaling level, its impact isn't limited to histamine alone. It broadly suppresses mast cell and basophil activation, even in non-IgE-driven urticaria. So, what's the clinical evidence? The approval of Remibrutinib was based on 2 phase 3 trials, REMIX-1 and REMIX-2, which studied patients with chronic spontaneous urticaria who still had symptoms despite antihistamines. At 12 weeks, patients taking Remibrutinib had a greater reduction in urticaria activity scores, compared with placebo. More patients reached well-controlled disease, or even complete symptom resolution. Impressively, some improvements were seen as early as week 1. Side effects were generally mild and included headache, nasopharyngitis, and abdominal pain. And unlike some targeted therapies, no routine lab monitoring is required. In short, Remibrutinib represents a shift in strategy, from suppressing symptoms to blocking the cellular signaling that drives them. By targeting BTK, it stops mast cells and basophils from releasing mediators before the cascade even begins. This makes Remibrutinib not only the first oral BTK inhibitor approved for chronic spontaneous urticaria, but also a milestone in allergy and immunology, bringing new hope to patients with hives that just won't quit. And that's it for today's pharmacology video. If you enjoyed this video, please give it a thumbs up and subscribe to the channel for more pharmacology content.